Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. You know, millions of people get flu and pneumonia every single year. It is such a serious thing. It is the 7th leading cause of death, those two illnesses combined. So we're talking with how to prevent that, how to deal with it, with Section Chief for Family Medicine here at Valley Health, Dr. Scott Davis. Thank you so much for being here.
Thank you for having me.
You're welcome. It's a issue that we have every single year this time of year. Tell me the difference, though. Let's start it off with the difference between flu and pneumonia.
Yeah. So flu and pneumonia, so when we talk about flu, we're talking about a very specific viral infection called influenza. So influenza virus tends to affect us a little bit worse than your typical cold symptoms. And pneumonia in and of itself is caused by multiple different microbes. So we're talking about potentially fungus, virus, or bacteria. And a lot of times following a flu infection, you can complicate and actually have pneumonia. So both are deep infections, but pneumonia affects your deeper airways and your air sacs in the lungs, and usually is a little bit more severe, where we feel pretty bad with flu, but typically it's not down in the air sacs like you see with pneumonia.
So pneumonia is a bit more concerning.
It's a step up on the severity level.
Tell me about the different populations that are at risk of these two.
Yeah, like a lot of respiratory infections, patients over 65, patients with other chronic conditions like heart disease, kidney disease, lung disease, asthma, anything that affects your immunity otherwise, you're going to have trouble fighting off these infections. Younger population as well, so 6 months to about 2 years of age, we're building our immune system, and that's why our babies have to come in and get so many vaccines, is to try to help with that process. So it does make sense that, you know, when they get infected in those first 2 years of life, they're going to have a little harder time clearing it, and they need to get closely watched.
Let's talk about symptoms. Are the symptoms different, flu versus pneumonia?
There's a lot of crossover. When you come to see us for one or the other, we try to hone in on a few details, the pattern of your illness and some of the vital sign changes, some of the lung sounds help us kind of tell the difference. But in general, with influenza, the hallmark with that, when you compare it to other colds, is it's a sudden onset. So with other colds, a lot of times you can kind of feel that scratchy throat, that runny nose, you start to get tired. With influenza, a lot of times it's just all of a sudden you're really sick, and high fevers and body aches and chills seem to be the hallmark. Now that is also the case with pneumonias, depending on the type. So bacterial pneumonia, a lot of patients will report some degree of shortness of breath, decreased oxygenation, fast heart rates. They're a lot sicker, a lot quicker as well, but there's usually those change in the vital signs and some lung sounds that we can tease out in the office when we do an exam. So when you feel that bad, it is important, make sure you get in for an evaluation so we can kind of tease out the difference and see what the severity is.
Let's talk about treatment options. I know that there are different medications on the market. What are they and how do they help?
Yeah, when we talk about influenza, so it is a virus, so antibiotics will help viral infections. So we do luckily have antivirals, and there's been different products over the years. We usually still fall to a product called Tamiflu if we're dealing with influenza. If you're especially high risk and you're not having a hard time getting over it, that's something that can be employed if it's used at the right time. But there is some caution, you know, if you're doing pretty well with a flu case and you're healthy, we don't expect complications or we're not seeing any problems develop, it may be good to avoid that Tamiflu use because we do see resistance develop with these antivirals just as we worry about with antibiotics.
Let's talk real quickly about flu shots and vaccinations. How do those play a part?
Very, very important. So every year the flu vaccine is produced new, and so we're always matching that up to the latest variant of influenza that we're dealing with. And that's predicted based on what we see in the southern hemisphere, usually about 6 months ahead of our flu season. And so as the virus spreads, you can get a little bit of a change in that our targets that we're looking at with the flu vaccine. And so that's why you hear about sometimes there's not a great match. But and when it comes to flu vaccines, a 25 to 30% match for our targets is actually a really good vaccine year. And so the idea there is if you get your vaccine every year, we're revving up your immune system and giving your body the best chance to, even if you do catch it, that you can fight it off without complications, and that's the main purpose.
Yeah, make it a little easier to tolerate. Yeah, we're in that season for sure. Dr. Davis, thank you so much. Thanks for checking in for Monday Health Minutes.